ask you a few questions. Can you move your finger? Can you smile? Can you tell someone about the cause of your smiling? So simple, right? The easiest actions of daily life can become impossible for some people. This is what is called locked-in syndrome, the situation when a patient, being fully conscious, cannot move or speak, and therefore, as Ronald Cranford reported, can be misdiagnosed and considered as brain dead.
He's brain dead.
I'm not dead. I need help. I'm here!
Blink if you can hear me. Oh, this is gonna be fun.
In this video, in 3 parts, I will tell you about the process of locked-in syndrome. The first part is causes of locked-in syndrome, the second, the manifestation of it, and the last part, recovery and life with such a terrible diagnosis. I will start from the causes part. The most common causes of locked-in syndrome are such things as infarct, hemorrhage, which is the loss of big amount of blood, and trauma. But locked-in syndrome appears only when these things cause the damage of lower brain, but without damaging the upper brain. This explains why the person remains conscious, and also explains why the locked-in syndrome is so rare among medical cases. The reason is, it's very difficult to damage the lower brain and brainstem without damaging the upper brain, especially when locked-in syndrome is caused by trauma. Then comes the manifestation stage. 2 main symptoms define locked-in syndrome in general. They are quadriplegia, which is inability to move one's 4 limbs, and anarthria, which is a loss of articulated speech. Also, locked-in syndrome has its own classification. The first type is classic locked-in syndrome. In this type, locked-in syndrome, which is also known as pseudocoma, leaves the eye muscles unaffected, and the person maintains the ability to communicate with the world through eye blinking and eye moving. The second type is called incomplete locked-in syndrome. It's pretty much similar with classic type. However, there are some remnants of movements other than eye movement. The last type, and the most terrible one, is total locked-in syndrome. This is because it's defined by total immobility and inability to communicate with the world. As we have already discussed the manifestation stage, let's move on to the recovery part. In British Medical Journal, the article called Locked-in Syndrome by Smith reported that there is a variety of outcomes after locked-in syndrome manifestation, from full recovery and no neurological deficits to no recovery at all. However, it doesn't matter what the outcome will be, there is still a communication barrier. Usually, locked-in syndrome patients have an ability to blink and move their eyes, which helps them to maintain an ability to communicate with the world. Typically, it's the blinking for yes and no questions. However, there are already special alphabets for locked-in stroke patients. Cheryl Ubilacker from CTV News reports that locked-in stroke patients find greater opportunities and independence with technology. And what can you take with yourself after watching this video? I guess it's an understanding of your abilities. Don't waste your time. Don't just exist. Most of you have such abilities some people do not even hope to have, but they are still trying to live a full life.